Okay, we're back with Dr. Christina Bratlund. Christina, I'm interested in your current project. What are you doing?
Well, I have very exciting research that I think it's exciting. And I mentioned the quality of life is a big factor in people who have swallowing disorders. One of the things that we currently do in the field of speech therapy when somebody's having a difficult time swallowing liquids is we found that if the liquid is thicker, they can swallow it more safely. The muscles have time. I know
that's almost kind of counterintuitive. You would think that the thinner, the easier it would go down.
Exactly, and that's what patients think. They say, "Well, I'm even having difficulty swallowing water," but actually, water is probably the most difficult liquid to swallow because, well, think about this. So if I had a bottle of water on this table right now, and through some mishap, that water got knocked over, we would both probably jump back a little bit because water spreads so quickly and in all sorts of directions. Versus if I had a cup of yogurt on this table and we knocked over the yogurt, we'd just look at it and grab a paper towel and wipe it up, right? Because it stays together and it doesn't. So if your muscles, say after a stroke, your muscles aren't as strong and the nerves aren't firing as quickly. As we get older, our reflexes don't trigger as quickly. So, so when you have water flying down your throat,
too much too fast, right?
Too much too fast, exactly. Whereas the yogurt, it still can slide down, but it gives our muscles and nerves a little more time, and it's a little easier to control and send it down. So that's one of the things is that if we can intake something that's a little thicker, our muscles can control it and it can go down the right pipe more easily. So what speech therapists have done is we've added a thickening agent to liquids, like you know how you'd add cornstarch to thicken a soup. It's the same concept, is that you could take your apple juice and add this thickener, and it makes it just a little thicker. It's still drinkable, but just a little thicker so it flows a little slower down the throat. Now the problem with this is how many people want to add cornstarch to their apple juice. That does not sound appetizing at all. And so my research says, I wonder if I could go to the grocery store and find some liquids that you would drink just sitting on the shelf there that would naturally be thick enough that you wouldn't need to add the thickener to. So for example, a yogurt smoothie, right? Is that thick? That's certainly thicker than water. So would that be thick enough to go down the throat smoothly, easily, without having to worry about adding thickener and all that confusion and difficulty?
Right. So how can you tell if it's the right consistency? So what, how do you know it's going down the right way? Or
So I have in my lab, I have a fancy machine called a rheometer, and that's a machine that can measure the thickness of a liquid. So I go to the grocery store, buy a bunch of drinks and soups and yogurts and anything that could be kind of considered a liquid, something that would flow. And I take it to my lab and I pour a certain amount in, and there's a cup and a spindle that goes down into the material and it turns, and based on how much resistance the liquid or the material gives to that turning, it can tell how thick it is. And it gives me a reading, and I jot that down into my computer and start looking at the thicknesses of these different liquids to see if they fall into the pre-described thickness ranges that our field uses.
So then once you have, presumably you're looking at different thicknesses in the liquids, and then you're looking to see how your patients respond. So what are you looking at in the patient to know if that's the right thickness? Right.
So that will be the next step, is because just because something is a certain measure on an instrument doesn't, how is that going to affect the person? So the next step will be, once I've identified enough naturally thick liquids, I'm going to do swallow studies with individuals and say, okay, well, we've identified this as a naturally thicker liquid, and we'll have people swallow it and see if it works better for individuals with the swallowing disorders to drink the naturally thick liquids, if that works better for them, if it goes down more safely, easily, and if they like it.
So do they tell you whether it went down the right way, or do you have instruments that help you know whether, you know?
Yep,
Yeah.
we have 2 different types of instruments that we can look. And actually, one is an X-ray machine, and we can watch a video X-ray. So it kind of gives us the Superman X-ray vision of the throat, because we can't see that. We can see inside the mouth if I was just doing a swallowing evaluation on you right here. I can see inside the mouth, but I can't see what's happening in the throat. And there's a lot of really important stuff for the swallow that happens in the throat.
Right.
So we can take individuals to the X-ray machine, and they take a video X-ray of the swallow, and we can see the material going down and see the muscles and everything moving and see if it goes down the right pipe or not. Because you do actually literally have 2 pipes in your throat, and so you can see which pipe the material falls down and see if that works. Or another type of instrument that we have is actually, if you've ever been to the ENT, sometimes they take a scope through your nose and look down at your throat, and we use that same technology. There's a camera on the end of this scope, and it hangs right down in the back of your throat, and we can watch the food or liquid that you're swallowing, and we can watch and see what's happening via a video camera in the back of your throat.
That's
so
cool.
we can do either of those.
Right. So once you get to the right thickness of material, do you think that'll be individualized? And then
Yes.
if it is, you know, when you treat a patient, can you will you personalize, okay, these are the things you need to look for in a restaurant or at the grocery store or something like that?
Exactly. Right, you've hit it right on the nose, because not everybody, when you have a stroke or when you have been in a car accident, any type of cause that would cause a swallowing disorder, Parkinson's disease, any of these types of things, they're all going to impact the muscles and the nerves differently. And if you have a stroke versus if I have a stroke, we're going to result in different swallowing problems, just because of the way that we are so unique as individuals. So also the severity of the stroke is going to require a different thickness. You might require things to be even more thick or less thick. So what I'm building is actually a whole continuum of naturally thick liquids, and the idea is to make that into a very specific list that therapists could, as they're doing an evaluation on a person, say, okay, you can handle everything from this line down.
Oh, that's cool, yeah.
You
So
know?
that'd be something they could even take home.
It's
yeah.
a hand shopping list, almost, to say, a pamphlet they could take with them that says, okay, I can go to the grocery store and buy a Kroger peach smoothie, yogurt smoothie, and that will work for me. But that point is so important. One of the reasons everybody hears about my research and they say, oh, can I have the list? Can I have the list? And it's not ready yet. And we don't want you taking it and saying, oh, this is a naturally thick liquid, it must be safe for me, because everybody needs to be so individualized.
Right.
And you need that speech therapist to kind of diagnose what is going to be safe and effective for you. And also because I haven't tried this yet. I haven't gotten to the stage in the research yet where I've tried this on patients, but
so clinical trials are next.
Clinical
right?
trials are next. Clinical trials are definitely next and in the works. But right now, it's very exciting. We're seeing really good things happening, and this certainly isn't going to. It's going to require a lot of research because there are regional variations. So the products available here in Michigan are different than the products available at grocery stores in Southern California.
Right.
So we're going to need to get a lot more researchers on board and measure regional variations and things like that.
Or even cultural differences.
Exactly.
Because of the food's excellent.
Exactly. So there's a lot of possibility and a lot of exciting things that we're seeing. We see really good potential for this to improve quality of life. Because I don't know about you, but if I had just had a stroke and I was in in the hospital and I'm still a little, what's going on, you know? And I saw somebody bring in Campbell's soup at hand, tomato soup. I recognize that. I can drink that. Versus if they had a cup of apple juice and they're adding some white powder to it.
Right, yep,
okay, is that a medicine? What is that? I'm not sure if I want to drink that. And
well, and even familiarity and taste.
Exactly,
at that point, right?
exactly,
Cool.
exactly.
Interesting. Well, I appreciate that insight, and thanks again for joining us. I really appreciate it.
Oh, my pleasure.